All right, we're officially numb, I hope. And now all we're gonna do is just sterilize the area with some iodine. You always wanna make sure the area is as clean as possible, as sterile as possible. You know, the issue always is that, you know, the only secure sterile environment typically is in the operating room, but we try to be as sterile as humanly possible here in the office. So, with that in mind, at this point, we start the procedure. In the first part, I just want to make sure that he doesn't feel anything, which doesn't seem like he does. So I pretty much, at this point, I kind of start lifting the nail plate from the nail bed underneath, and that's all I'm doing, is just with this instrument, I'm kind of pushing the nail plate, and it's forcing it to lift up all around. And again, slowly, slowly lifting it up from all sides. And now that I'm pretty lifted up in the back, and then making sure the front is lifted. Okay, now I think we could probably take a shot at removing the nail. In this case, usually if I'm doing either of the corners, I go straight to cutting the corner. But in this case, because we're lifting the whole nail, I just cut down the middle, just like that. And then at this point is when I use this other instrument called a hemostat to remove that bit of the nail. We've removed half of it, and now we remove the other half. And voila. Nail removed. And at this point, our main job is just to look at the nail bed and make sure that it looks clean, which it does. And I don't see any signs of infection or anything like that. And I just take off this little piece. Right there. And at this point, the procedure is done.